Hello there, everyone. I'm Galen Morse, and welcome to Journey to Recovery. We appreciate having you along today. This podcast is entitled The Pros and Cons of Working as a Co-Occurring Disorders Counselor, Part 2. On today's program, we'll talk with Dr. Hal Baumschen about this growing field of co-occurring disorders. We'll cover 10 disadvantages of working as a counselor with mental health and substance abuse clients. Thanks for joining us today. Our podcast focuses on the co-occurring disorders of mental health and substance abuse. We present a wide range of thought-provoking, hopeful, and positive topics from a clinical yet practical perspective. And we provide a solid, truly integrated co-occurring disorder resource you can use in your treatment program or in your own recovery. Our host is Dr. Hal Baumschen, a licensed clinical psychologist and licensed alcohol and drug counselor. He's the Executive Director of Northland Counseling Services and the Clinical Director of North Star Regional Co-Occurring Disorder Treatment Programs. He's an author, speaker, and clinician with over 30 years of counseling experience. I'm here today with Tim Bodie, Operations Director at Northland Counseling Services, and with Dr. Hal Baumschen, our host at Journey to Recovery. Hey, Tim, maybe you can give us a little review of what we covered last week.
Thanks, Galen. I'd love to do that. So last week we talked about the 10 advantages of working in mental health and substance abuse, and I'm just going to quickly review those for our listeners.
That sounds great.
So advantage number 1 was that you would have work. Number 2 was to make a positive impact on individuals and their families. Number 3 is to make a positive impact on the community. Number 4 is that you'll have work that's highly challenging, creative, and different each day. Number 5 is you have the opportunity to earn a decent income. Number 6 is you can work for yourself. You can be your own boss if you choose to do that. Number 7 is you have the opportunity to develop your own character. Number 8 is to work with a team. Number 9 is the opportunity to train others. And finally, number 10 is that it gives you the opportunity for flexible work schedules. So those were those 10 advantages. And today we're going to talk about some disadvantages to working in the mental health and substance abuse field.
Do you see some disadvantages from your role as operations director of a counseling center? Not really? I mean, I think it's hard work.
You know, his job might be on the line here, so I can understand his trepidation.
I do see some of the stress that therapists working in the field encounter.
Yeah, and you take some of the complaints from them too.
Right.
You know, I mean, the difficulties that they face, and even some of the complaints from a client might actually come to your office.
Correct, and the clients that our therapists work with are struggling with many issues a lot of times. So it's not common, but it does happen occasionally that they will become upset with what they perceive as not being adequate treatment. And then I do get to hear some of those things. But those are things that therapists probably hear more frequently than I do, those kind of negative things. Right.
I've been in the field now for over 30 years and have done a lot of counseling. So today we're going to talk about the disadvantages of a field that I think is terrific. I think it's great, and I'm happy to be a part of it. Dedicated my life to working with people and being in this field. But we're going to talk about it's not for everyone.
Right.
And even when you enjoy your job and you feel great about it, there's still some difficulties in it. We're going to try to mention a few of those. So we've called this program 10 Disadvantages of Working in Mental Health and Substance Abuse Field. Let's take a look at the first one, Tim.
Yep, and we talked about this a little bit last week. But the first disadvantage that we'll talk about today is that not everyone gets better.
Right. I think one of the advantages, just like you mentioned, is that we help people. And I feel really good about that. And then Galen brought this up last week when we were talking about, hey, we help people and we inspire them and encourage them. And then Galen said, yeah, but not everybody gets better. Thanks for bringing that up.
Well, you have a really good memory.
Yeah. Well, I do some thinking about this because that's one of the sadnesses of this is you're pulling for people and hoping for them. And then there's a relapse. Maybe a chemical dependency person has a relapse or a slip. Maybe they go back into the hospital. A mental health client has a return of depression symptoms. and occasionally somebody dies of suicide. It's very difficult, and that's a disadvantage of being in this field, is that people don't always get better. Somebody goes to the hospital again, or gets incarcerated again, or their children get taken away. These are tough things to deal with.
Has that been tough for you?
You know, I had somebody on my caseload that passed away of suicide, and I had been in the field for about maybe close to 15 years before that happened. And I thought, Galen, if that had happened to me in year number 1, I don't know if I would have been able to take that. So I think I've seen people get rehospitalized, relapse, of course, die of overdoses. These are tough things. I care deeply about people, and it is hard for me, but I do have the ability to try to move on and help those that I can. It's a tough one. Even thinking about it now, that's a disadvantage of this field. It's a tough part of this field.
And it's good for people to be aware of that, as you said, before they consider going into the field.
I think, if you went into banking hoping nobody ever bankrupted or nobody ever lost their home, that'd be an unrealistic expectation of that field. Right. I think we do really need to face not everybody gets better in this field, and if you're uncomfortable with that, maybe it's not the right field. Yep.
And the second disadvantage, I think, is directly related to that, and that is the fact that it's a stressful field.
Long hours, demands of your clients, demands from staff, and from your boss. That can be difficult for people. Stressful work environment. One of the things that's a stressful work environment is being with people all the time, and people can be stressful. And another thing can be some boredom or some downtime, depending on your position in the field. And then conflicts that come up between counselors and management and clients, and conflict in general. I mean, you have conflict in your parts of your life, and Galen, you do too, but there's conflict at work sometimes. I think I'd like to think that we're professionals, so it goes along maybe smoother in our field than it does in some, but yeah, there's probably some conflict.
So go ahead, Galen.
It's easy to talk generally about these things, but I'd like to know how you personally deal with that stress.
I use a lot of cognitive behavioral strategies, so I talk to myself about the situation, and I talk favorably to myself about myself, like I can handle this, or God's with me wherever I go, or I'll get through this, or I've seen worse, or this is a small thing, or keep a good attitude here. The problem isn't the problem. It's your attitude about the problem is the bigger problem. So I do a lot of self-talk. That's helps me. I also I enjoy everything I do. So I could be pulling a Kleenex out of a box and I'll find it funny. And so that helps de-stress things if you can laugh about certain things and keep a good sense of humor, see things from a kind of a humorous side. And I probably have pretty good self-care. I sleep pretty well and that sort of thing.
All right.
How about you? How do you handle stress? Well, what would you guys say?
I try and do something I enjoy.
You're a projects guy. So that's a kind of a distraction from the stress of life, isn't it?
Yep. And for me, just getting outside and being out in the sun, listen to the wind through the trees, that kind of thing helps relieve stress for me.
And both of you guys, I think, use music to de-stress, and you both enjoy that. I know that about both of you.
Yep, that's absolutely true. In fact, when you may know this about me, if I'm feeling somewhat stressful at work, I'll play some very soothing music in my office, and that helps me.
Yeah. You have music on all the time, Tim. So I never. That means you're stressed all the time. That's a bad thing. I didn't know that.
It's not always the same music, though.
You use a slightly different music if you're stressing?
I do.
Oh,
yes.
okay.
Yeah.
How about you, Galen? You use music?
Not so much. I will use it, yes. But technology is my kind of both an avocation and a vocation. And it can be the cause of stress.
Yeah.
But it can also be the relief from stress.
That's good.
Tackle a new program, something like that.
And you're working on a new program now, aren't you?
Well, this is the stress side of it, not the de-stress side.
Well, we're losing our focus here. So what else is a disadvantage? The disadvantage of being a counselor in mental health and substance abuse.
Yep. Number 3 on our list is that it's emotionally demanding.
Right, we've been talking about the stress of it, and maybe this is akin to that. So listening to people with their difficult problems is, in fact, demanding. When people come in with their relational problems, criminal activities such as gang experiences, or their irresponsible behaviors, or their life in jail, their alcohol and drug problems, all of that can place a demand on the counselor. Traumatic experiences, I think, are often tough for counselors to listen to. Just had one of my practicum students who heard, probably for the first time in her life, the horrific story that clients sometimes tell. And she listened to a guy who was just terribly abused as a kid and taken advantage of and in a foreign country and placed in a gang. And it was very violent history, and she had to hear about that, and it was emotionally demanding and stressful for her, and a new experience for her as well.
Have you seen any of the clinicians that work for you struggle with this?
Yeah, I've seen, just like that woman that I just talked about, I think she really struggled with that, Galen, and I've seen people who've been kind of beat up by the career just leave the field because it was so emotionally demanding, so stressful, like I'm out. I've got to find something that's easier. For me, I think I would take stress with me. So I often say that if I went to work for a fast food place to get away from the stress of counseling and working in this field, on the first day at my fast food job, I'd be like, wow, this is great. The second day, I'd be like, I'm learning a little bit. The third day, I would see some things that could be changed. On the fourth day, I'd be worried about it. I would carry the stress with me, I think. It's not just the field, it's who you are and how you handle stress.
Sure. Number 4 is sometimes you can have a difficult schedule.
Right. Do you remember from last week we were talking about one of the advantages was you could have a flexible schedule,
right.
Maybe set your own hours. Some of my clinicians that work for me, we have 30 clinicians in 3 locations, and they like working their own hours. And, hey, I can't come in on a Tuesday, or I want Fridays off. We've got a psychologist who works for us, takes every Friday off. He doesn't consider it taking it off. He just works a 4-day work week, and that flexibility is really nice. Other parts of the job can actually feel like a disadvantage where you have to work evenings, weekends. Clients can't come in during the day. Right. You want to serve your clients, so you're faithful about working 2-3 evenings a week, and you do that for years. That can be stressful in this field.
Right, and particularly we may see that in a program where there are group programs that meet, and some of those have to meet in the evenings, again, to meet client needs, and we need counselors to work in those programs. So,
one of our co-workers, he told Tim, hey, why don't you hire a counselor to work from 6 o'clock to 9 o'clock 4 evenings a week? Well, who wants to work that shift? So we all laughed about it. He thought it was like, yeah, well, somebody would want to do that. So I think sometimes it's very difficult to find somebody who's willing to do that.
Yep.
Before you guys move on, allow me to jump in here for a minute. Direct our listeners to some of the resources that are available on our website. We're always adding new materials such as podcasts, blog articles, lessons you can use in your center. And we invite you to share this resource with friends and family who have an interest in recovery. Also, check out Dr. Hal's Co-Occurring Disorder Lifestyle Resource Manual. This manual is packed with clinical wisdom gathered over 30 years. It's a full-color and easy-to-read resource containing hundreds of treatment ideas and strategies that work. You'll find this resource thought-provoking, hopeful, and positive. Here's Tim to tell you how you can get your copy.
Thank you, Galen. To purchase a copy of the Journeys Manual, visit journeytorecovery.com and click on Workbook in the top menu. You'll find a description of the manual there and also an option to purchase a copy for yourself or for your work in your treatment center.
Last week, we talked about the advantages of working in the mental health and substance abuse field as a counselor. This week, we're taking a look at some of the disadvantages. We've already talked about 4 of those, I think, and we've got another one.
And this one, number 5, is somewhat dependent on your working situation, whether you're in private practice, whether you're working for an agency or a program, and that is billing and getting paid.
So I suppose if you work in a treatment center or a hospital and you see mental health patients, you don't have anything to do with billing. You just get your salary, your pay for that, and somebody else worries about billing the insurance company or receiving payment from the client directly. Although the people who work as contractors or as therapists in private practice, they do concern themselves with billing and getting paid, and that becomes a disadvantage in this field because it is stressful to be dependent on clients coming in and then billing them or billing the insurance company and waiting to get paid, and you're not sure how much you're going to get paid exactly, and that can be very stressful.
Right, and insurance, as we probably all know, is very complicated. So that whole process of billing insurance and working through whether charges are eligible, that can take some time, so that can add to the stress of the job.
Are there services available for those that don't have insurance or that just don't have the money to pay for the service?
Yes and no. It's a struggle in the field, Galen, trying to find placement for somebody who desperately needs services, but we can't take them, the hospital can't take them, the clinic down the road doesn't have any openings. So yeah, it can really be difficult. However, kind of on the positive side, if you look around, you can usually find some place to get somebody some treatment, both for chemical dependency. Really, in our state, it's easier to get help for chemical dependency and have some governmental payment plans than it is for mental health. Mental health can be a little tougher to find somebody. Even in our clinic, we have clinicians who are on a sliding fee scale. We use some of our trainees, practicum students, and interns to work with people who don't have any fees or funds for service. So we can usually provide service for anybody.
Mm-hmm. And some people say, or I've heard people say, well, you're in this field to help people, like, why don't you just do it for free, essentially? But, our clinicians and therapists, people in the field, they need to pay their own bills too. So that's, even though sometimes that can happen, that's not an option all the time.
Right. I did say that to my plumber and to the electrician and to my accountant and to the attorney that I use. Like, I thought you were in this field to help people. Why don't you do this service for free? Well, they need to collect their fees, and feed their families as well.
Right. Let's move on to number 6, which is the 6th disadvantage, which is paperwork.
I'm sorry. Did I just spit all over you? I'm really sorry.
So there's a bit of paperwork if you're working in this field, isn't there, Dr. Howell?
Right. And more all the time, where the insurance companies might audit you and they're looking through your records to make sure that you actually treated the client the way you said and you provided the service that you said and that it fit the treatment plan that you wrote, and that you have a note that followed the treatment plan that you wrote, and that you did an assessment on the person so that you put the right treatment plan together and then followed with the right treatment and then wrote about the right treatment. So all of that, and it has to be done in a timely way. And then if you send records on to somebody else, they've got to be accurate. Mm-hmm. So yeah, there's a hassle. There's some great things about paperwork in terms of there's some good services that are out there that help with that, and some electronic medical records that make it a little easier for keeping track of all of those things.
Right. And then if you are in a program that is licensed, for example, licensed by Minnesota Department of Health and Human Services, then there may be additional paperwork for those programs that you have to complete in order to stay licensed. So,
one of the things that I often tell new recruits in the field is that in this field you have a lot of bosses. Let me go over that. So I just hired you. You have me as a boss. But you also have the referral source who sent you a client, and they're going to feel like a boss over you. And the insurance company that pays the bill, and the client herself or himself will feel like your boss. So just a lot of bosses in this field, people that you want to keep happy and make sure that you do everything right.
Mm-hmm.
You don't really mind the paperwork, do you?
Oh, man. It backs up. Yeah. Did you hear about the butcher who backed into the meat grinder and got a little behind in his work? That's how it is with
That's
paper.
the feeling. Okay.
Yeah, that's the feeling. So thanks for bringing that up. I got to get back to the office. We're going to have to end now because I got paperwork to do. No, I sometimes feel like I can't die. I've got paperwork.
Yeah.
I'm not done with it.
So we better keep moving then. Is that what you're saying?
Exactly.
Total aside, I had an insurance man who was a friend of mine, and someone else in his company, not his office, one day went, for those of you on camera, slid everything off of his desk into a wastebasket and hauled it out to the garbage.
Right.
There were lawsuits, et
Yeah.
cetera, et cetera.
Yeah. Wow.
And I'm sure you've got the same kind of responsibility that you've got to finish that stuff.
Even when
Yes.
you're frustrated, you can't push it off your desk. Yeah. Oh, you can delay on it, but that stings too when you do that. So it's a disadvantage to the field that you sort of have that hanging over your head all the time. And like many things, you can sort of get caught up, but you can never get ahead.
Yeah.
Right.
Yeah, that's true.
Okay, number 7. The job or responsibilities of the job can be highly unpredictable.
We talked about one of the advantages being that things are always changing and there's this creative aspect to it. And boy, there's no routine, isn't that great? It's not boring. And then on the downside, the flip side here, disadvantages that the field can be unpredictable, your job can be unpredictable, clients can be unpredictable. You're working in a high-pressure situation with individuals that may relapse and become unpredictable themselves, and that adds to the tension and frustration that people feel on this type of job. In fact, the stress associated with working with individuals that have a serious drug problem caused many workers in the field to leave for other types of the employment. It was just too stressful to deal with. Mm-hmm. The job itself can be unpredictable, and you don't know what the day or the hour will hold.
Do some clients kind of start out relatively easy at first and doesn't turn out that way in the end?
Right, just a simple example where you think this is going to be a very pleasant conversation with this client and we're working through some minor issues and they come in that day and they've had a tragedy in the family. And this has happened to me. I'm just working with an eating disorder woman. This is many years ago now. And she came in one day. I think she called me on the phone, so I knew about this in advance, but her husband died in a plane crash while she was a client with me. And so things, how would you expect that to ever happen? And so it's unpredictable, and that causes some strain in this career.
Mm-hmm. Okay, number 8, disadvantage number 8 would be the difficulty of maintaining a balanced life.
Because of the stress mentioned above, I believe people need to keep work and love, projects, and people all integrated in a kind of a finely tuned harmony, but that can be difficult to do.
I was going to say, that sounds great, but I'll bet it's not always easy.
Right. And I like work, so I have to be careful that I don't work too much or work all the time or get too focused on that. And other people, maybe they hate work, and so they've got to kind of get themselves to do that. We got to find a way to keep the balance here.
And I think that a lot of professionals in the field are well aware of self-care. Not that means everyone is good at it, but I think that we also encourage that among our therapists.
Right, that they take some time off, don't work every day. Get some rest every week, of course. Sleep well. Take some vacation time. We've got some people who like to travel. Some of our therapists travel together. That's sort of fun to watch that. Gail and Cynthia have taken trips together, and they enjoy each other's company.
Right, and I know some of our therapists will schedule time during their day when they can just have a break, get out of the office, go for a walk, go somewhere else, and that also helps them with their self-care.
Right.
Number 9, having family and friends ask for counselor advice. This never happens to you, does it?
Well, you're torn between wanting to help and feeling responsible for people, but then not wanting to work anymore or hear any more problems. And I have a friend who's a dentist, and so one day he's going to ask me for advice about his marriage. And so to start the conversation that he knows is probably not going to be fun, he says, so every now and then people come up to me in church and pull their lip back and point to a tooth and say, hey, Doc, I've got this problem. What do you think? And so he used that to introduce, like, I'll bet this is going to be a real pain for you because I don't like it when people do that to me, and now I'm going to do it to you. So I would say that people do ask me, and I try to be helpful, but sometimes I'll be trying to get out of church as quick as I can so I don't get tied down with somebody else who needs to ask me another question.
Yeah, when I tell people I work at Northland Counseling, I sometimes get the start of a question, but I'm not a counselor, so I can say, like, sorry, I'm just the operations director.
My mother lived with us for about a decade, and Don moved in next door, and Don is an executive for Best Buy Corporation. And so my mother heard that Don worked at Best Buy, so she had a little problem with her VCR. So she was going to run over and ask Don how to, program it or fix it or whatever it was, assuming that if he worked for Best Buy and they did electronics, he would somehow magically know the answer to all electronic questions.
Yes.
Tim, I've got a problem. Could you help me with I bet a lot of different professionals, as you mentioned, your dentist, get that sort of a situation.
Right. And like Don got it, and Tim gets it. I'm sure you get it too. Hey, Galen, could you help me with this piece of technology or something? Some audio equipment.
What's the best TV to buy? What's the best recorder to buy?
Yeah.
Yes.
And we get it in this field, and it can be a disadvantage where you feel like you're on call for your clients, and then you're kind of on call for family and friends too. And we don't often make the best clinicians for family. It's probably better to just try to refer them on to somebody else, and you just get bogged down with your side of an issue, and you complicate things about being objective. You want to be objective in this field, and you can lose objectivity when you're talking to family and friends.
Sure.
I have a friend that actually it's a relative who does marriage counseling, and that situation arose where a very close relative said, will you counsel my son and his future wife? And it led to some real difficult situations.
Right. In our clinic, we try real hard to have kind of a firm boundary there, and we don't work with each other's families, and we try, we don't hire anyone who has been a client in the past couple of years.
Right. And then let's move on to our last disadvantage, and that's that it can increase your risk for mental health problems and relapse.
So we're talking our way through a list of 10 disadvantages of working as a mental health counselor or chemical dependency counselor. One disadvantage is if you're in this field, it's kind of stressful. And if you have a chemical dependency problem, we want to make sure that you've got a kind of a good long time of sobriety before you enter the field. It's 2 years, but many people like even more than 2 years. But it's stressful, and sometimes you hear about people in the field relapsing.
Now, I'm sure somebody out there is asking this question. Do you have a problem with personal problem with addiction? Did you?
Yeah, that's a good question, and I do get that in the treatment facility. I think, especially with drug and alcohol counseling, people think that everybody in the field has a history, and I don't. I don't have a history of drug or alcohol use or abuse or chemical dependency problems. I've not had treatment for that in the past, and not had mental health problems that were severe either. I suppose I've been anxious in the past. Never had treatment for chemical dependency or mental health problems. But I do get the question from time to time. But again, many people in the field have a history of struggling with something. Now they're back on track, back on top of their game, and they're in the field, but they're at a little higher risk of having difficulty in the future. Something to keep your eye on, and it can be a disadvantage because if you were to relapse, you can't work in the field.
Right. And it's interesting when we interview candidates for particularly co-occurring positions or even practicums, and we'll sometimes ask, like, well, how did you get interested in the field? And many of them do talk about either they had some personal history themselves or a family member who they saw struggling, and that motivated them to want to help others.
People ask me how I got into the field, and I think I really don't know how to answer that. I think there's so many factors, and you follow a course, and there's a lot of green lights, and you keep going where the green lights are, and you don't go where the red lights are. So I think some of that just fell into my lap somewhat. But I do have had a brother, he's passed away now, who had schizophrenia. And so I think, that family problem that you see growing up, and maybe it makes you more sensitive or interested in chemical dependency or mental health problems. So that's true for me as well.
So that brings us to the end of our advantages and disadvantages list. And I'm wondering, after that discussion, Dr. Howell, what do you think of the field that you're working in?
Right. So we looked at 10 advantages and 10 disadvantages. So those are equal, right? Well, although we mentioned 10 of each, I'd like to weigh them out. And if you put weights to each of those, I think for me, they weigh differently. The advantages outweigh the disadvantages of being in this field.
Even though there's 10 of each.
Yeah, right. But they weigh more. They're more important to me. The advantages are more important than the disadvantages. And so there are a couple reasons to not get into the field, but there are a lot of reasons for me to be in the field and to keep doing it. I'm happy with it. I like helping people. I like bringing hope to other people. I love it when somebody gets better and it changes their life, changes their family. They stay married, they stay sober and clean, they get back to work, they stay out of jail. I love that. And I feel like I was part of that.
Absolutely.
Yes.
Yeah.
Well, thanks everybody for listening to today's podcast. We were discussing the 10 advantages and 10 disadvantages to working in the mental health and substance abuse field. Certainly enjoyed having you along with us today. We invite you to check out resources on the web at journeytorecovery.com. We've been visiting with Dr. Hal Baumschen, a licensed clinical psychologist and licensed alcohol and drug counselor. I'm Galen Morse. Thanks for listening to today's program. See you next time on Journey to Recovery. Remember, recovery is a journey. Enjoy the ride.